We're just waiting for people to come in. So, and then we'll get started. So welcome. Welcome everyone to our annual members meeting for the Canadian Network for Neglected Tropical Diseases. Bienvenue à tous. Aujourd'hui, nous allons avoir les discussions en anglais, mais si vous avez des questions ou des commentaires en français, s'il vous plaît, utilisez la langue de votre choix. So it's my pleasure to be the moderator for today. I'm Alison Krentel. I'm an associate professor at the University of Ottawa's School of Epidemiology and Public Health and a scientist at the Briere Health Research Institute. And I'm the current chair of the Canadian Network for NTDs. So a couple of housekeeping notes. We're all very familiar with these kinds of calls, but please do keep your microphone muted and share any comments you may have in the chat. It's also a good chance for you also to let us know where you're calling in from. So feel free to introduce yourself in the chat. So we'll have the formal part of our program for the first hour, and then we'll have time for discussion during a more informal meetup for a half an hour at the end of the webinar. So as we begin today, I'd like to start with a land affirmation. We express gratitude towards the Indigenous peoples who have and will continue to steward these lands here in Ottawa, where I am calling from today, and from all nations across Canada. We acknowledge the traditional knowledge keepers, both young and old, and we honor their courageous leaders, past, present, and future. So today's webinar will focus on Canadian partnerships for global NTD integration. Today is also Universal Health Coverage Day. So our speakers focus on the integration of NTDs into primary health care and into health systems is most appropriate. We have a great panel of speakers, as you can see here, coming to us from the African Union, the Pan American Health Organization, and Effect Hope, each bringing unique experiences on NTD integration strategies, highlighting both current and potential Canadian partnerships to ensure that people living with and at risk for neglected tropical diseases receive their right to health. So before we start today, I would like to set the stage for you with a little bit of what we've been up to at the Canadian Network for Neglected Tropical Diseases in 2024. So we'll cue this video.
We started the year with World NTD Day celebrating the progress made towards the WHO NTD roadmap goals and raising awareness about NTDs among Canadians and the Government of Canada, working with global partners to unite, act, and eliminate NTDs. We partnered with Orbis Canada to deliver a webinar on Canadian engagement in global trachoma elimination strategies, among several other events and media engagements. We sent a letter to the Honourable Minister of International Development, Ahmed Hussein, inviting him to a multi-stakeholder meeting to learn about Canadian efforts to end NTDs. International Development Week followed, where 2 Canadian senators raised awareness about NTDs, and we engaged in broader campaigns within the international development sector, asking the Government of Canada not to back away from its ODA. In spring, we inspired inclusion on International Women's Day and welcomed 3 new steering committee members, Dr. Kumbo Kalua, Dr. Nomar Moretti, and Dr. Innocent Nteganira. We intensified our G7 NTD advocacy, supporting the C7 communique, and signed and delivered a joint letter to our G7 leaders to step up and fund neglected tropical diseases. We met with PAHO Director Dr. Barbosa on his visit to Canada, joined a PAHO Civil Society Roundtable, and met with Canadian-based PAHO WHO collaborating centers contributing towards global health equity. And we brought NTDs to the Healthy World Conference. We welcome summer with a new Kigali Declaration Commitment from the NOMA Action Group, a blog for World Dengue Day, and a webinar on youth action on climate, water, and NTDs. The last of our summer days were spent on consulting with members to develop our pre-budget submission for Federal Budget 2025 and submitting written consultations to Canada's approach to Africa and climate finance. Dr. Alison Krentel, the chair of our network, welcomed fall at the PAHO headquarters in Washington, D.C., moderating technical sessions on PAHO's disease elimination agenda before heading to the World Health Summit in Germany to advocate for continued Canadian engagement in global NTD prevention and treatment, and attend panels on the impact of climate change on NTDs and on women's health issues, including female genital schistosomiasis. Steering committee members Manish Philip and Dr. Kumbo Kolua met with other NTD networks at the NTD NGOs conference in Malaysia to strengthen community engagement in NTDs. Next, the Canadian Network for NTDs presented on the impact of climate change on NTDs ahead of COP29 to the Global Cooperation Caucus and All Parties Caucus. Then the Canadian Network for NTDs went to the Canadian Conference on Global Health in Vancouver, BC, to deliver a symposium on NTD elimination through and beyond displacement. We also presented our NTD Research Award 2024 to Dr. Claudia Dugway, who joined online to receive the award. We took a deep dive into rabies and leishmaniasis through our blog posts, and we supported the launch of a new report on fighting neglected tropical diseases in French-speaking countries. The Canadian Network for NTDs also attended several multi-stakeholder events where we got to meet the Honourable Minister of International Development and other global health stakeholders. We are ending the year with this event today, and by giving a warm welcome to our new student and young professional NTD ambassadors and getting ready for World NTD Day 2025.
So it's been a busy year, we can say. So thank you for sharing that video. And now I'd like to turn over to our first speaker with opening remarks. We're honored to have the Honorable Senator Stanley Kutcher with us, who will be opening our webinar today. We've been grateful for your partnership over the last few years. So the floor is yours, Senator Kutcher.
Thank you very much. And it's a privilege to be here to address the members of the Canadian NTD Network. And I want to acknowledge all those of you who have joined this from multiple different time zones around the world. Thank you very much for ensuring that you have got on this call. It's my sincere thanks for all the hard work that you are doing to improve the lives of people globally. The NTDs as an issue is not an issue that is necessarily well known by many Canadians, and thus you can't be properly acknowledged for the incredibly good work that you do. And so I want to do it, just to acknowledge and to let you know how much appreciated what you are doing is, both from my many years, decades of working in the Global South and currently, more recently, as a senator in the Parliament of Canada. We're really proud of you. And you do great work in this important sector with partners around the globe. I just want to acknowledge the incredible activities of Dr. Alison Krentel, who I think has a key to my office, because almost every day that I walk in here, there's more things from the NTD network, or if there aren't, she's here herself. So Alison, I want to just acknowledge that work. When I look back on your year, and it was an incredible video to see, you can see that you have achieved many, many different successes. From these, I will just highlight the one, the trachoma elimination work that the network is doing with PAHO. And I want to thank PAHO for your incredible leadership in this, and to the Government of Canada for providing some of the funds that you need to do the work. And I'm very, very pleased that Dr. Krentel from Canada is now having a continued and more obvious presence at PAHO, because one of the things that I have been doing here is trying to enhance the collaboration between Canadian scientific leadership and the PAHO leadership. I do, however, not want to just have this short discussion look at all the good things. There are concerns. The biggest concern, as I see it, is the geopolitical concern that will happen on January the 20th. We are not sure what the US will do, whether it will draw completely or in part from the global health work that it is currently doing, myself and many others here in this country are concerned of the potential rise of anti-science-based health decision-making and what that could mean for all of us. On the geopolitical level, this means that we have to change how we operate a bit, that we have to invest in the rise and leadership of like-minded states in multilateral collaboration. For example, those of you who are following it, the Baltic states in their collaboration to support Ukraine. Health must be, global health must be, NTDs must be on the global health agenda, not only as part of the health agenda, but as part of the geopolitical agenda. We can't have peace and security in this world if we don't have equitable access to health care and if we don't address the diseases that cause so many difficulties to most of humankind. I'm not sure exactly how we're going to solve this emerging problem, but I know that your organization, multilateral health organizations such as PAHO, the WHO, and our governments have to start this conversation now, because we all have to work together to improve the lives of people globally. And this means enhancing the activities and the resources and the work that we're doing to address NTDs. So once again, thank you for everything. Bon chance, and have a good rest of your day with your meetings.
Thank you so much, Senator Kutcher, and thanks for inspiring us also to think forward to 2025 and to keep our foot on the pedal, so to speak, as we move into next year. So continued thanks for your partnership, and we look forward to working together next year. So thanks very much. It's now my pleasure to introduce our next speaker, who's going to provide some opening remarks as well, Senator Mohamed-Iqbal Ravalia, who together with Senator Kutcher and Senator Peter Beam have been great champions of the network and raising awareness about neglected tropical diseases here in Canada. So we'll show a short video of his remarks now. Thank you.
Good day. It is an honor to join you today for this important discussion on sustaining momentum in the fight against neglected tropical diseases and the opportunities that lie ahead for global NTD integration. I commend all of you, advocates, practitioners, and partners who are working tirelessly to address these diseases that disproportionately affect the world's most vulnerable populations. Canada has long demonstrated its commitment to global health, and our involvement in combating NTDs reflects our values of equity, collaboration, and compassion. Through partnerships with organizations like the Pan American Health Organization and the African Union, we have made significant strides in prevention, treatment, and awareness. These collaborations showcase how Canada's leadership and innovation contribute meaningfully to global progress. As we reflect on these achievements, we must also look ahead. Sustaining momentum requires a steadfast commitment to integrating NTDs into broader health, social, and economic systems. This integration ensures that our efforts are not only impactful, but also sustainable over time. By embedding NTD programs with national healthcare strategies and aligning them with global health frameworks, we can extend the reach and longevity of our collective impact. The Canada-AU Memorandum of Understanding offers a valuable platform to advance this work. By incorporating NTD elimination into comprehensive strategies for health, nutrition, and development, we can strengthen systems and improve lives in some of the world's most underserved regions. As we near the final stages of NTD elimination, the last mile demands renewed focus, energy, and resources to ensure lasting success. Continued Canadian investment and engagement in NTDs are critical, not only to honor our international commitments, but also champion global health equity. Together, we can strengthen partnerships, expand integration, and move closer to a world free from the burden of neglected tropical diseases. Thank you to the NTD network and everyone here for your leadership and dedication.
Thank you, Senator Ravalia. And we are delighted that he was able to share some of those remarks with us today. So our final speaker in terms of our opening remarks, I'd like to introduce Mellissa Hisko, who is the Director for Global Immunization and Health Systems at Global Affairs Canada. And we welcome Mellissa to share some perspectives from Global Affairs Canada. So the floor is yours, Mellissa.
Thank you, Alison, and good morning, good afternoon, good evening to everyone. Thank you for the invitation to make some opening remarks at this webinar, which provides a chance to reflect on global achievements and opportunities in the fight against neglected tropical diseases through Canadian partnerships in NTD integration. I'd first like to build on both honourable senators' acknowledgements and recognize the leadership and the hard work of our Canadian and international partners in advancing the elimination of NTDs. You're doing very important work. Canada has been a long-time supporter of efforts to eliminate NTDs, and together with our partners, we've supported international public-private partnerships since the 1970s. And these partnerships have helped achieve some tangible progress in the elimination of NTDs, an example of which is river blindness, which has now been eliminated in 4 countries in the Americas, I believe. Since the London Declaration in 2012, we've observed some significant commitments to advance the fight to eliminate NTDs, but there's still very much work left to be done. For our part, Canada endorsed the 2021-2030 WHO roadmap for NTDs, and we participated in the launch event in 2021. And most recently, in 2020, Canada signed on to the Kigali Declaration, which, as you know, aimed to increase commitments to support the implementation of the WHO's roadmap for NTDs. And it was encouraging to see a high-level declaration to increase commitments. And Canada is proud to match our own commitments with concrete support to our partners. For example, in October of 2023, we announced a $15 million project with PAHO to eliminate trachoma in 10 countries in the Americas over the next 5 years. Thank you to PAHO for this important leadership. Since the project began, all endemic countries have made progress in implementing the WHO recommended strategies to eliminate trachoma, and 5 of those countries are advancing in the rollout of rapid assessment protocols to detect the disease. In addition to our dedicated programming, we do believe that the efforts to address NTDs must be integrated into broader health system strengthening approaches to ensure that people have access to the full suite of essential health services that include things like WASH and nutrition and sexual and reproductive health and rights services. And we encourage all countries to develop and implement national action plans that promote multi-sectoral approaches. In this context, Canada also advocates for the integration of gender equality, of human rights, and the participation of women as key decision makers in our public health efforts to eliminate NTDs. So to finish, I applaud the Canadian Network for Neglected Tropical Diseases for maintaining high-level attention on the need to end NTDs. We look forward to continuing our partnerships into the future. Initiatives such as this webinar are key to identifying new opportunities to work with Canadian, regional, and global health partners to eliminate NTDs, to strengthen health systems, and to improve primary health care for those who need it most. Thank you.
Mellissa, thank you so much. Thanks for joining us today and for sharing the perspective, your perspective from Global Affairs Canada. And we're just delighted to have the engagement with PAHO and the engagement of Global Affairs in the Kigali Declaration and all that that means. So thanks for being here today. So it's my pleasure now to introduce our first speaker, Dr. Sheila Shawa-Musonda. She is the Technical and Partnership Specialist at the African Union Commission under Health Systems, Disease and Nutrition in the Directorate of Health and Humanitarian Affairs. She's also a member of the ARISE Technical Advisory Group and an alumni of the Harvard School of Government. So Sheila, the floor is yours, and we look forward to hearing from you. Thank you.
Thank you so much. Are you able to view my slides?
They're just coming on. Yes, they're there. Yeah.
All right. Okay. Now, thank you so much for this opportunity and for being part of this webinar. I'm just going to highlight some of the work that we're doing on the African continent in terms of the control and elimination of NTDs and how we're trying to integrate this into the broader health system. So I will not go to the background. I'll share the slides, but I think I'm preaching to the choir because we all know the background on NTDs. But I wanted to highlight this slide, which shows the commitment that we have received from the heads of state on NTDs. For a long time, they were embedded with the broader health programs such as HIV, TB, and malaria. And then we have them in the Agenda 2063 that explicitly says that Africa should be rid of NTDs by 2030. We have gone further to define them in the Africa Health Strategy. But more recently, during the launch of the WHO roadmap, when the team Mwele and the team were doing consultations with on the African continent, we agreed to develop something that was more specific to the African continent, feeding into the overall roadmap. So we got what was in the overall roadmap and then tried to contextualize it to the African continent. And so we came up with the continental to end to control and eliminate NTDs by the year 2030. And we also came up with a common African position, which just gives guidance on how the continent wants to forge ahead in eliminating NTDs. And so these are the two documents. The common position is just a collective agreement, recognizing the need, concerned about some of the things that need to be addressed, but also providing recommendations. It also goes into detail to try and allocate roles and responsibilities to the member states, to the Commission, to our developmental partners and the donor communities. The documents are accessible on the AU website. So for those who want to access them, you can just search for them online. Now, the continental framework has 10 strategic areas, and as previous speakers were highlighting the need for integration, you see that this is where we are going as a continent as well. And so some of the things that we outlined in the strategic approaches was the need for domestic resource mobilization. So for a long time, NTDs have been funded by partners, and the programs are not funded by the national government. And so we're trying to request that there should be a need to provide some level of funding. We're not asking for so much money because we know it will be difficult to ask for a big amount, but it can be even 10% as a start. And as the programs are being implemented, this can grow with time. So there's need for domestic resources. We are talking about human resource mobilization to ensure that staff are trained in identification, diagnosis, treatment of NTDs, harmonization and coordination at national level among the different ministries, but also within the different partners, the players that are supporting the countries on NTDs, community engagement, because we know these are community programs, and if owned by the community, then we'll be able to see a reduction and that seriousness that is required. We have integration into other programs, utilization of alternative strategies, research, and categorization of interventions. And so the documents are quite explicit on how we can do these things, and we provide some priority actions that countries can take to implement these. Further, I think one of the things that we noted was that, yes, we may have good policies in place. We set these policies up, but there's no mode of monitoring and evaluating the progress. And so we have actually a detailed M&D framework in the continental document, and where we are actually asking for progress in terms of how the strategic objectives are implemented. And so this is just one strategic approach number one. This is what we expect. So for example, by 2025, we know that the baseline is 0, but by 2025, we want to see at least 25 countries in providing some level of financing. It could be just for operations, but a minimum budget towards NTDs. And by 2030, we expect all the 55 countries on the continent to have a budget towards NTDs. And so we have quite a number of M&D indicators that we expect the member states to report on. So now the document was endorsed in 2022, and based on the endorsement by the heads of state, as I was saying, the recommendation is that countries report. And so by 2024, we had the first cycle of reporting, because the report is supposed to be done every 2 years to the STC, the Specialized Technical Committee on Health, Population and Drug Control. And from the STC, this report goes to the heads of state to just see how the countries are faring. And so for the first 2 years, it's quite a significant progress for us. It might not seem as much, but where we knew that countries were not responding, we're able to get 29 countries give us an update on how they have fared in terms of implementing the continental framework. And so you will see here that the gray bars show countries that have funding from governments for their NTD programs. There are not so many countries, but I think it's a good start, because the fact that they are reporting will ensure that next time they really prioritize this. Then you see the lighter shades of blue are indicating where they have a full functional NTD program. Now, I should mention that for a long time, most countries had NTDs as a sub-program. It was under NCDs, it was under diseases, but there was no full-fledged program. And with this advocacy, we're seeing, I think you see here from all the 28 countries that responded, that they have a functional NTD programs. Of course, we'll need to do an assessment of how fully functional it is, but the fact that there is a program in place is quite helpful. And then the dark blue lines are just indicating if the NTDs are included in the national health policies, strategies, and plans. And as we are talking about the inclusion, the integration into the health systems, as we attempt to achieve universal health coverage, I think this is quite critical, because we know that in terms of data, although we have activities happening for NTDs, the data that is being collected is not integrated into the national health systems. And I'll talk about a bit more on it on my last slide. And so this one shows the strategic planning and funding. Again, I think we're trying to see whether the ministry was leading the advocacy and collaborating with other relevant ministries in terms of NTDs. Now, in overall, the NTD program in most countries falls under the Ministry of Health, but you find that activities such as deworming might fall under the Ministry of Education, under the feeding program FAO, you might find that deworming, larviciding falls under the Ministry of Veterinary Medicine or Environment or Agriculture. And so there is need to have that conversation between the relevant ministries. And so we try to see if there was that collaboration. We're also trying to see the stakeholder technical working groups, because we know some countries have strong collaborative technical working groups with different players who are supporting the NTD program. So we wanted to see whether countries have this, how many of them have, and you can see from here, while the majority is indicated that they do have stakeholder collaborative technical working groups, others did not. I think we were looking for this indicator because for Togo, that eliminated 4 NTDs. I think one of the things they highlighted was the fact that they had coordinating technical working groups with various stakeholders, including the WASH team, veterinary, all those different players. And so we're trying to promote this among member states. And then the dark blue is the availability of appropriately trained staff. And this data was focusing on entomologists, but we know that we need the lab technicians who are trained to identify, for example, LF. They should be trained to identify Schisto. And so we are going to expand this further, but in terms of entomologists, we can see that most countries do have trained entomologists, but these will only cater for vector-borne diseases and not the other NTDs. Now, we had some best practices and challenges, and we just generalized this, where yes, most countries had entomologists and medical microbiologists who were able to identify the diseases. Some countries had pre-service training for the CHWs that they were utilizing for health promotion and drug distribution. And then other countries had already started integrating NTDs into the overall health programs. And then we have countries like Uganda and Ivory Coast that had sufficient number of entomologists throughout. But we also noted some challenges, including poor funding to the programs, difficulty in accessing quantitative measurements and reporting, which was suboptimal in terms of the prevalence of NTDs and treatment. We also had weak monitoring systems and supervisions for NTD programs. And the major one is competing programs, where we have, programs such as HIV, TB, and malaria being prioritized, hepatitis over the NTDs. Now, these are just case studies, and I will not go into detail, but I think you see that when we're reaching out to the countries, we're trying to get those that had shown some significant progress, and South Sudan is one of them. I think a couple of years ago, South Sudan did not even have an NTD program, but with the engagement that we've been having with them, the partner support, where we're seeing a number of partners supporting their initiatives, they have a good program in place. They were starting their mapping from scratch, but they've made significant progress, and this has been because they've really advocated, and some of the things they're focusing on is, apart from the advocacy, is integration into the overall existing initiatives and focusing on cross-border coordination. And I think they highlighted their BOMA initiative, the fact that they are prioritizing WASH, and then they have several meetings with various technical working groups to address NTDs. And the next is, for Morocco. So Morocco has a strategic roadmap that is expiring next year, and it will be revised, and we've asked that they align it to the continental framework, but they have also ensured that NTDs are included into the overall health plan. They are not addressed as a segment or a component, but they are part of the overall programs. We've seen that they are addressing NTDs through a harmonized approach, and they've included it as an essential package in the healthcare package. So we are seeing that countries are prioritizing, and because they're taking different strides, because the context is different, but we're seeing a significant improvement in addressing NTDs. And the third country is Ethiopia. I think we've seen how Ethiopia has actually included NTDs into their primary health package. And this, I think, is a way of ensuring that they're addressing UHC. And they've done this by ensuring that there's full mainstreaming of innovation and intensified disease management. But they're also, there's also partial mainstreaming in some areas. But the fact that they're actually integrating it into primary health is showing, is encouraging, because then we know that NTDs will be prioritized, they will no longer be neglected, and whatever initiatives are being applied in the overall health systems will be applied to NTDs. Now, I'm going to show this slide. I'm about to wind up, but I just want to show where we are at. So when we started in 2020, we did a survey to see how countries were performing in terms of NTDs, and we had a number of questions. So in 2022, we went back and asked them if they were able to capture and report on NTDs using their DHI or HMI system. Now, we had a number of questions that we asked them to respond to, but this one was critical because you can see that only the countries in green indicated they were reporting NTDs through their national health systems. The ones in yellow were only reporting leprosy. The ones in red were not reporting, they were not capturing at all. And the ones in gray did not give us any information. So if we are talking about eliminating NTDs, we need to have the right data. We need to capture the data. we need to ensure that our programs are targeted, because then right now we're doing MDAs, but the way we are doing our MDAs is that we're just assessing if in this area we have more than 10%, then we assume the whole area is eligible for MDA, and we just give NDAs to a lot of people. But if we have the data and it's captured and we have targeted treatment or interventions, whether it's treatment, whether it's larviciding, whether it's prevention, then we'll be cost effective in our approaches, because right now we're just really shooting and hoping that we're getting the right target. And so one of the requests, at least one of the gaps that we want to address from the NTD, from the AU, is to ensure that countries are supported in developing proper data collection systems where there's capacity being built so that countries can report from the community level to the national health systems. Once we have this data, whatever interventions we want to target, it will be more effective, because we'll be planning based on data and information, unlike based on estimates and approximation. And so this is one of the key push for us now to make sure countries are reporting, they're collecting the right data, and this data is being captured at a continental level. Thank you so much.
Sheila, thank you so much. Thanks for your time, making time to be with us today. And as was mentioned earlier in the webinar, we really look forward to the new Canadian AU MOU and seeing how that agreement is going to allow us to see more integration of NTDs into the primary healthcare system. So thanks for getting us started. And now it's my pleasure to welcome Dr. Ronaldo Carvalho Scholte from the Pan American Health Organization. Ronaldo serves as the technical officer within PAHO, within the Neglected Tropical Diseases team, and he provides technical support to member states on their elimination and control programs within the Latin American and Caribbean region. So Ronaldo, welcome, and thanks for joining us. The floor is yours.
Thank you very much, Alison. Please let me know if you can see my presentation.
Yes, we do. Thank you.
Great. Well, first of all, I would like to say thank you to the kind words of Honorable Senators Kutcher and Ravalia, and from Ms. Hisko from the Global Affairs Canada towards PAHO. And just say that without the partnership with Canada, all this work would not be possible. So thank you very much for all involvement on this project. Well, my idea here is to talk a bit about the Pan American Health Organization's elimination initiative and its impact or effect on the neglected infection disease in the region of the Americas. So to talk a bit about the elimination initiative, we need to go back a couple of years and to a pre-pandemic time. And in September 2019, the Governing Council of the Pan American Health Organization approved the Communicable Disease Elimination Initiative, which is an innovative policy that promotes an integrated and sustainable approach to accelerate countries' progress toward eliminating more than 30 diseases and related conditions. The Elimination Initiative integrates individual disease programs into a unified framework, promoting synergies and collaborating toward elimination. It adopts a life cycle approach, emphasizing human rights, gender equality, and vulnerable populations across health systems. It enhances institutional and community capacity to monitor progress and generate evidence. It advocates for an intersectoral government, coordination and participation of civil society and communities. In addition, it seeks to improve access to quality health service, strengthening primary care, and promote universal coverage. As mentioned before, this initiative focuses on more than 30 diseases and related conditions, including neglected tropical diseases, which is highlighted here. But due to the limit time of this presentation, we have more than 20 neglected tropical diseases. I will focus on 9 diseases shown this slide, which are under direct supervision of our team at PAHO, Washington. After the launch of the elimination initiative, we have seen a lot of activity, and countries such as Brazil, Colombia, El Salvador have developed robust national strategies, while Chile, Honduras, Guyana have established interprogrammatic coordination mechanisms to advance the elimination of multiple communicable diseases. That's just a small example of the commitment of the countries with the disease elimination in our region. And why neglected tropical diseases, right? We can see here that around the world, 2 billion poor and marginalized people are suffering from those diseases. They are caused by virus, bacteria, and parasites, and they have different ways of transmission. And around 90% of the global burden are in our region of the Americas. So after we saw and heard so far what we are seeing here this day, it's important to mention that it's not that the disease is neglected, but the affected population. And that's something that PAHO would like to change. So talking a bit more about the diseases, again, as the previous presenter said, I don't want to preach to the choir. A lot of you know much more than me about those diseases, but I will show some advance and next steps on those diseases. For soil transmitted helminths, we have around 46 million children from 1 to 14 years old at risk of infection in our region. And so far, we are doing some strengthening capacity about laboratory. And it's integrated with other parasitical diseases because they share the same diagnostic methods and ways to improve mass drug administration. We are already implementing some surveys to measure the impact of the deworming campaigns. Nicaragua already did this, and other countries are following it. And we are always working with the countries on training workshops, and we develop a course at the PAHO I forgot the name of the platform right now, but we developed the course on the soil transmitted helminth at the PAHO virtual campus. So for program managers and health workers. As a next step, we are mapping endemic areas for surveys. We would like to try to optimize the way that surveys are done to save time and money, and then focus just on areas of interest. We are reinforcing the warming campaigns for the countries to achieve their targets, strengthen and monitor evaluation, and improve water sanitation. That's some points that PAHO is looking at it, because WASH it's not just for one disease specific, but it could make other diseases better. Lymphatic filariasis, our curiosity here is that we just only have Wuchereria bancrofti going on the region, and our vector is Culex fasciatus. So it's different than the other areas in Africa that have 2 species. In our region, we had 4 endemic countries, but Brazil received his validation by WHO this year. So we still have Dominican Republic, Guyana, and Haiti as endemic countries. As achievement, as I mentioned, Brazil was validated. The Dominican Republic is in post-treatment surveillance. Guyana interrupted the treatment in 6 out of 8 endemic regions, and Haiti has a 80% reduction in the communes doing the MDA. As a next steps, the idea all the countries need to expand the essential package of care, and the Dominican Republic need to submit the dossier. Guyana, with some assistance of Dr. Krentel's team, they are doing some extra MDAs, and we are focusing on the never treated population. They just finished one this year, and they are planning for next year MDA. And Haiti needs to stop the treatment in the last 18 communes. So about Chagas disease, we have 20 countries endemic. We already decreased the number of vector transmission, control, transfusion transmission, beginning of regional control of congenital transmission. That's a very important point for PAHO. And beginning of comprehensive patient care in national health systems. As a next steps, the idea is to continue a sustainable and integrated vector management, assess to universal and comprehensive care for people affected by Chagas disease, address the diagnosis and treatment of congenital Chagas from the perspective of maternal and child health. Hansen disease, we have we divided the countries in four categories. Very high, it's we have just one country. We have high with 8 countries, moderate with 8 countries, and low with 18 countries. We already developed chronic care for NTDs, for leprosy, LF, trachoma, and Chagas disease. And our next steps is focus first on the low number of cases countries, which is 10, less than 10, to move forward to the interruption of transmission and elimination of leprosy. On the moderate countries with 11 and 100 cases, we are reinforced a strategy to interrupt transmission and elimination of the disease. And on the countries with a high number of cases, we are moving toward with a plan to interrupt the transmission. For fasciolasis, we have just 2 countries endemic for it as a human problem, but it's an economic problem for the meat production perspective on all the region. So we develop a plan of action for the elimination of human fasciolasis as a public health problem together with a One Health approach because it's affect mainly the cattle. And a strengthening laboratory, that's the activity we are doing integrated with other parasitical diseases. As a next step, it's implementation of mass drug administration and evaluation surveys and One Health intervention for animal reservoirs. For schistosomiasis, again, another characteristics for our region, we only have Schistosoma mansoni, different again for other countries, which has more than 1 species. And we already started the verification process in one of the islands in the Caribbean called St. Lucia, which we believe that has interrupted transmission. As a next steps, we believe together with St. Lucia, we have 8 Caribbean countries probably eliminated the disease, but it's still pending a verification. But again, we need to develop alternative methodology to verify these countries and territories. As we know, the guidelines, it's a one size fit all, but we need to tailor for each community And here, interculturality and gender, it's very important because it needs to be focused on the population specific. For YOS, maybe many of you doesn't know what YOS is. It's caused by Treponema pallidum subspecies pertenui. It's the same family as syphilis. We already had a regional meeting with 13 countries, and we developed a stratification of these countries for elimination. And next step is going towards the certification. So we have 16 countries without history of YOS, 25 countries with history of YOS without case since 2013, and 2 countries with history of YOS with reported cases since 2013. For onchocerciasis, we have just 2 countries endemic, and this area is the Yanomami focus in the border with Brazil and Venezuela. Again, here, interculturality, it's a big point because this is a nomad population which crossed the border, which doesn't know the border between those 2 countries and cross freely all the time. So we need to tailor activities to tackle this population. Achieved so far, we have the elimination verified in 4 countries, Colombia, Ecuador, Mexico, and Guatemala. And our idea in the next steps is to interrupt treatment in the Yanomami focus and start the post-treatment surveillance. As my last slide, last but not least, I would like to talk a bit about trachoma, and that's where we have this great partnership with Canada. So far, we have been achieved a lot of good things in the region. We have endemic 4 countries, suspected 5 countries, and Mexico has been eliminated trachoma. As a next steps, together with this Canadian partnership, we are bringing technical cooperation with 10 countries in the Latin America. And as mentioned by Ms. Hisko, 5 of them already started their rapid assessment protocol, but not only looking for trachoma, but applying for other diseases too. So we are bringing a concept of the universal health to the trachoma project. And all these activities are integrated with public health, with gender and intercultural approaches too. So our goal with the elimination initiative is to make our region better, improving the quality of life of the population, and help is welcome. And I like this image a lot because it sums it very well, and all the help it's very, very welcome. Thank you, gracias, obrigado, and merci.
Thank you, Ronaldo. And it's a great image to end with. It's very cheerful and happy. So thanks, and great to see some of the results of the Canadian PAHO partnership. So thanks so much for being here and sharing your remarks from PAHO. So I'd like to introduce our last speaker today, I'd like to introduce Anna Wickenden, who is the Vice President at Effect Hope. She provides leadership in advocacy, policy change, and the integration of NTD initiatives into the health systems. Effect Hope is a Canadian NGO that focuses on addressing NTDs with projects in the Africa and Southeast Asian region. So Anna has provided a video today, but she's here in person with us. So feel free to pop any questions or comments into the chat box. So we'll cue that video now. Thank you, Anna. Welcome.
Hello, good morning, good afternoon. Hope you're all well. It's a pleasure to be here. My name's Anna Wickenden. I am the Vice President of Advocacy and Strategic Partnerships here at Effect Hope. And I was really pleased when Tina spoke to me about the opportunity to present on what I think is a really exciting and innovative project that we've been involved in for the last 10 years in Liberia, which really shows the impact that integration can have on breaking down some of the barriers to access for NTD care. So for those of you that don't know, I just thought I'd do a very quick introduction to Effect Hope. So Effect Hope is a Canadian global health organisation. We have an office in Markham, but we have a team that spread all the way across coast to coast in Canada. We are focused on impacting the lives of people affected by NTDs. We were founded in Guelph in 1892. We were initially founded as the Leprosy Mission Canada, and as you can imagine, our name and our work has evolved over time, but there are some of those core principles that were there at our founding that we've maintained throughout time. We're actually supported by nearly 10,000 individual Canadians from every province in Canada, and they're the main source of our financial revenue, but we've also been lucky enough to partner with the Canadian government since the 1970s in projects addressing NTDs in Asia and in Africa. So our organization is guided by an organizational theory of change. We have 3 core themes to our work. One is access to NTD care. One is mental health and NTDs. And the third one is equity and inclusion. So the way that we work is through strategic partnerships. We generally don't implement directly ourselves. We have some brilliant partners who are much better placed to do that. So we provide technical and financial support to them. We work with World Health Organization, ministries of health, local NGOs, and other technical partners and universities as well. So now I'd love to talk to you about what we're doing in Liberia. We have been working in Liberia actually since 2012, but in 2016, following the Ebola outbreak, we really worked with the Ministry of Health to take the learnings from Ebola and apply them to the NTD context, where we could really look at what would be the best way to break down the barriers that exist to NTD care in Liberia. So just a quick little bit about Liberia. Liberia is a small country on the coast of West Africa. It is very beautiful and has an interesting history. It had previously, before some of the more recent troubles, been known as the Monaco of Africa, and was a place where, if you look at some of the old photos, people were dressed in these incredible, like 1970s kind of flares and outfits, and it was a really beautiful place. Unfortunately, they've gone through a lot of turbulence with the war and then with Ebola, but it's an incredible place to work, and the resilience of the team there is just always amazes me. So our goal in Liberia is that all people in Liberia will have equitable access to care through the public health system, and our specific focus within that is NTDs. So prior to this program, there was really a fragmented and inequitable response to NTDs in Liberia. Access to care was completely dependent on really how much money you had, where you went, and who you knew. So as I said, this fragmented model of NTD care, where most of the provision was provided directly by NGOs and mission hospitals, meant that there was a real inequity in access. The cost of this kind of programming, this vertical programming, was incredibly high. The level of delayed diagnosis and late stage diagnosis was really, really high, which meant that disability levels were also disproportionately high in Liberia. There was a deep stigma related to many of these diseases. The sustainability of this sort of response was not there, and the fragmentation meant that there was really no sense of who was doing what and no coordination amongst the different service providers. As a result of this situation, there was very limited ownership by the government of the overall NTD response to NTD care. So following Ebola, really a lot of people have become a lot more aware of the importance of a resilient health system. And what we did for this program was to build on the 6 building blocks of the World Health Organization and contextualize them along with multiple people and teams from different departments within the Ministry of Health. So some examples of what we did in the different building block areas was we developed an integrated NTD case management strategy that became part of the overall Ministry of Health policy. We conducted a training of trainers module at all health facilities that worked in a cascade through the health system. We tested performance-based incentives. We really invested in supportive, practical supervision. We integrated NTDs in the national supply chain where they had not been there at all previously. And we integrated NTDs into the national HMIS. And just to give a bit of an idea of the situation prior to doing this, there's one NTD called Buruli ulcer, and you don't hear that much about it, but it can only be treated with a specific set of antibiotics, and without it, it can be very, very serious and can lead to really permanent disability and infection and sepsis. And actually, in the local language or in the local colloquial languages, the word they use for it means everlasting sore. And it was called that because if you got this particular type of ulcer, there was no treatment for it. That was it. You had it forever. There was no capacity within the health system to diagnose it. There was no medicines within the health supply chain to treat it. And so we wanted to transform that and make sure that these NTDs were no longer neglected from the health system. So what we developed was one master plan and a harmonized and coordinated response that worked through the health system. As a result, there were lots and lots of learnings from the initial pilot phase. I'm not going to go through each one of them now because unfortunately I've got a 10-minute limit, but just to highlight four. Following the integration of NTDs in the health system away from vertical and NGO-based service provision, we saw a 4 times increase in the number of cases detected. We demonstrated that the need, the gap, and the feasibility of the provision of psychosocial support through the health system. We integrated through the work that we were doing, testing the data in the HMIS. We were able to demonstrate that the routine case data does not reflect the actual disease burden and that there are lots of cases that are not being found through the health system. And we also were really able to demonstrate the value of the inclusion and partnership with traditional and faith healers, which was a big part of the program. One of the areas of results that we hadn't been anticipating, but that's been really striking, is the impact on broader health systems resilience of this type of approach. So the literature on resilience talks about the difference between everyday resilience, that's the resilience to the chronic pressures that affect health systems in a lot of these really low resource settings, and the link between that and resilience to acute crisis. If a system doesn't have a high level of everyday resilience, its capacity to be resilient to acute crisis is significantly affected. And you see these resilience factors. It's by a researcher called Barassa, and he identified these 8 areas, these 8 factors of what can help to make a resilient health system. So as part of our analysis, we looked at the Liberian model and were able to identify in each of those resilience factors how the integration of NTD care in the health system directly impacted health systems resilience to both chronic pressures and acute crisis. So that was all kind of concluded in 2022 at the end of the initial pilot stage. And now we're in our second phase, which is really learning, adapting, and scaling from our initial pilot. So as part of this next phase, we're trying to expand from 5 counties where we were doing the pilot at the community level. We're expanding nationally to ensure a minimum package of case management services should be available at all health facilities in Liberia by 2027. We have areas to strengthen the building blocks as well. So where we've done some work, there are some that need a lot more input. And we've also enhanced our work of making sure that people affected by NTDs with lived experience are more involved in the planning and evaluation of the intervention. So just to give you some more specific kind of examples, we will be improving early case detection and contact tracing, including leveraging the preventative chemotherapy platforms for case finding. We're going to be looking at how we can build surgical capacity in a systemic way to respond to NTDs. We're going to work with the supply chain to improve the access to the medicines and commodities needed for NTDs. And that's already been done in a lot of ways. We have been, we've coded the medicines and commodities so that they're all now in the electronic, the LMIS and in the central medicine store systems. We have integrated process indicators, so program implementation and performance indicators into the HMIS. We have continued to deliver an enhanced training package to the remaining cadres and counties that were not included originally in the first pilot. We continue to conduct implementation research as a big part of this program to really test new ideas and innovations and to see what works best. And we are testing the feasibility and impact of integration of NTDs in the national performance-based financing mechanism. This was important because it was really one of the building blocks we weren't addressing, the financing side of it. And so we want to try this and to see whether or not what the impact of inclusion of NTDs in PBF is, not just in terms of cases, but also from an equity lens. We will continue to map endemicity and distribution of unknown NTDs. And we really are keen to strengthen the inclusion of female genital schistosomiasis, which requires a different set of partners, but is a really serious issue in Liberia, and it's a really important issue that we need to make sure that we address moving forward. So just to close, and given the audience that I have here, I just want to make a bit of a pitch for some of the advocacy and partnership opportunities that are there based on our experience in Liberia. And one of the broader ones is that we really see the need for greater integration of women's health and gender in the NTD response. It's an area where we've struggled in many ways. And I think that it's something that a lot of the stakeholders in Canada have a real strong expertise in, and would be really, really love to explore that more. The integration of NTDs, especially the neglected issue of female genital schistosomiasis in programming by Canadian NGOs and the Canadian government. Proactively identifying collaborations that can leverage different expertise to strengthen the equity and resilience of NTD interventions. Supporting the scaling of health systems-based approaches to breaking barriers to NTD care through Canada's investment in health system strengthening. We know there's significant investment happening now in health system strengthening. We want the Canadian government to really understand why including NTDs in that is really important. And increasing the understanding and engagement of Canadian stakeholders more broadly in NTDs, and also exploring opportunities for advocacy to include NTD care in UHC service packages, because that's been an area where there's been some neglect. So I'm sorry I've gone over slightly, but I hope that's okay. And thank you very much for your time. And please do get in touch if you would be interested in learning anything more or sharing your experiences or exploring any of these opportunities. Thank you very much for your time. Bye-bye.
Thank you so much, Anna, for a great presentation. What a great range of speakers. So today we've heard about the importance of Canadian partnerships to address neglected tropical diseases. And the WHO's 2030 NTD roadmap compels us to integrate NTDs into the health system. So our speakers today have demonstrated how to integrate NTDs using policy from a disease perspective and through national health systems. So thank you once again to Sheila, to Ronaldo, to Anna for sharing your remarks and your experiences today with us. So I'd like to introduce Tina Lines, our Policy and Advocacy Officer. Tina's organized today's event, so big thank you to her. She's going to introduce our new student and young professional ambassadors. So over to you, Tina.
Thank you so much, Alison. This is our 5th year hosting an SYP, a student and young professional NTD ambassador. And heading into 2025, we'll host 2 talented NTD ambassadors, Brianna Anderson and Ronnie Alawi. Brianna is a 4th year undergraduate student at York University pursuing a biology major and sociology minor. She's committed to advocating for a world where neglected tropical diseases no longer burden vulnerable communities. Here's her video en français, and she's also joining us today. Thank you.
Explorons le rôle de l'innovation de la technologie dans l'éradication des maladies tropicales négligées. Les MTN sont des maladies répandues dans les régions tropicales touchant plus de milliards de personnes, principalement des communautés marginalisées, renforçant les inégalités de santé mondiale. Elles peuvent être zoonotiques, transmises par l'environnement ou véhiculées par des vecteurs, compliquant leur contrôle. Cependant, l'innovation et la technologie moderne peuvent soutenir les stratégies d'éradication à chaque étape. La télédétection et les données satellites peuvent être utilisées pour suivre la distribution des vecteurs avec le changement climatique, les réservoirs animaux et les taux des infections, qui facilitent ainsi des réponses opportunes. L'intelligence artificielle peut améliorer cela en traitant des volumes plus grands de données historiques et actuelles. Puis la technologie permet l'engagement communautaire. Les médias sociaux favorisent la coopération qui est essentielle pour appliquer efficacement des stratégies de santé. Elles créent des systèmes de rétroaction avec la participation de la communauté, rendant les programmes adaptables aux besoins changeants. Puis de nombreuses mesures de contrôle innovantes existent telles que le génie génétique et la stérilisation des vecteurs, les applications de la science vétérinaire pour traiter les réservoirs animaux, et les programmes d'eau et d'assainissement. Des algorithmes prédictifs accélèrent le développement des médicaments et vaccins, d'ARNM et la modélisation épidémiologique et la recherche sur les vecteurs. Les MTN touchent principalement les communautés à faible revenu. Il est donc important que la technologie propose des solutions abordables et durables pour éviter l'aggravation des inégalités de santé. L'innovation renforce les systèmes de santé existants et donne plus d'autonomie aux communautés locales aussi. La technologie est essentielle dans l'éradication des MTN en permettant la détection précoce, l'engagement communautaire et le développement d'outils durables. L'efficacité de ces technologies augmente avec la collaboration interdisciplinaire et un focus sur l'équité. C'est dans une utilisation appropriée et une distribution équitable que l'innovation et la technologie soutiennent les stratégies d'éradication des MTN.
Wonderful, and we also have this video as well in English, and this will be available on our website and on social media. And now we have Ronnie. She is pursuing a Bachelor of Health Sciences from the University of Calgary. She's passionate about community empowerment, global health leadership, and equitable health care. And here is her video in English.
In a world brimming with technological advancements and medical breakthroughs, it's easy to believe that we've conquered the most significant health challenges. Yet, a group of diseases known as neglected tropical diseases, or NTDs, persist primarily in impoverished communities of tropical areas in Africa, Asia, and the Americas, affecting over 1 billion people worldwide, yet still remain poorly recognized by the global public health community. So let's talk about innovative technology and neglected tropical diseases. NTDs are a diverse group of 20 diseases, each presenting unique challenges that are caused by infections via bacteria, parasites, fungi, or toxins that are oftentimes present in environmental, zoonotic, or vector-borne settings. Specifically, they thrive in areas marked by poverty, inadequate sanitation, and limited access to healthcare. The consequences of NTDs go much more upstream than just physical suffering, such as cognitive impairments or mortality, but they can also trap families in a cycle of poverty and social stigma, limiting children's access to quality education and ultimately hindering economic growth. However, the international health community is paving a way for hope of eliminating NTDs through leveraging the power of technology and innovation. So how exactly can we use innovation and technology to eradicate NTDs? Well, geographic information systems can be used to track disease patterns, allocate resources strategically, and measure the impact of interventions in even the most remote locations. Additionally, telemedicine, automated microscopy, wearable technology, and genomic or biotech innovations all contribute to revolutionizing advancements in eradicating NTDs through faster diagnoses, personalized treatment, and more effective disease management. But technology alone isn't enough. We need to ensure these advancements are accessible to the communities that need them the most. This means making them affordable, easy to use, and culturally sensitive. By encouraging effective interventions through collaboration, advocacy, and spreading awareness to family and friends, we can break down barriers to accessibility through the power of innovation and collective action.
Thank you so much, both. I really look forward to working with you in 2025.
Thanks so much, Tina, and welcome to our two new student and young professional ambassadors. So this is a great program that has allowed us to have a greater reach across Canada. So I'm delighted to have you. And for those of you who are interested in joining, we usually launch in the fall of every year. So next year, stay tuned for opportunities there. So we have about 15 minutes remaining in our program, and I just want to open the floor for any questions or comments that you may have from our speakers, or just in general. And so I'll just open the floor now. There are a few that have come online. And so I'm happy also to highlight some of those questions. There's one I'll just start here, one for Ronaldo. What is the strategy and this is from Andre Domche. What is the strategy used in the Americas to achieve onchocerciasis elimination in some focus? And he is coming from Cameroon and is talking about persistent onco prevalence there. So interested in hearing a little bit what strategy is used in the Americas for onco. So we'll start with you, Ronaldo, and then I'll select a question also for Anna. Go ahead, Ronaldo.
Sure. Thank you, Alison. Well, thank you, Andre, for the question. Well, the strategy was primarily focused on treatment. As you all know, ivermectin is a wonderful medication, but needs to achieve the stomach of the person, you know. So we mainly did annual or semi-annual treatments, and the number of rounds of treatment ranged country by country, but it was around 20 to 27 with coverage above 85%. So we really put our effort on treatments here. And the prevalence in the region, I mean, we had 13 foci and in 6 countries. And the prevalence ranged between 2 to 79%, something like that. But our main strategy was treatment. Thank you.
Wonderful. Thanks, Ronaldo. And a question for Anna. I'd be interested from your perspective and the work that you've done in Liberia, you know, as we think about what the global program is asking us to do in terms of better integration. What do you think has facilitated Effects Hope's success in working together with Liberia in terms of really integrating NTDs into the health system there? If you could name that special thing that you think really contributed to some of the success you've had in terms of ensuring sustainability of integration of NTDs.
Yeah, thanks, Alison. I think I'm going to cheat a little bit because I've just finished doing my PhD research on it. So on what I think has really worked in Liberia was the process that we used to develop the initial policy. So I'd say like there's 5 kind of key elements to it. One is the people, the place, politics, power, and process. And I think that what we really did was to develop a policy that worked for Liberia. And part of that process was really making sure that it was participatory. We developed it together. We developed a high level of trust with all the different stakeholders. And I think that having that level of trust meant that some of those really difficult decisions about things like the harmonization of incentives or how we were going to bring together multiple different programs where you had this fragmentation were able to happen because there was an investment in the time and space to build relationships and build trust. And then the other thing that I think was really, really important was allowing the ministry to lead, and not just on paper, but really allowing them to lead. And it's been interesting as we've analyzed the reason why it was able to kind of work in Liberia. One of the big things was that people want, like the people involved in developing this approach expended a lot of their own human capital and political capital in developing and arguing for and mitigating resistance to integration. Integration is deeply political in some ways. It can be very difficult and very complex. But most of the time, if you've got a shared vision for improved health or the end of NTDs, if you've got strong leadership and you can keep people focused on that, then you can work your way through those problems as long as you can trust each other and you've got those relationships. So I think it's remembering that policy is still about people, and that the more that you can build those relationships with people, the more likely it is that a policy is actually going to work.
Yes, that's wonderful. And I love the word mention of trust, because I think all of these partnerships are based on the trust between entities. So thanks so much for sharing that. Another question's come up for Ronaldo from Musa Sangare. What is the strategy that PAHO is using to address cross-border transmission? And he's asked for schisto-onco or LF, but would just love to hear your perspective on the cross-border.
Thank you for the question, Musa. Well, we don't have this issue with schistosomiasis and filariasis. Recently, even in Haiti and the Dominican Republic, they share the same island, the Hispaniola Island. The Dominican Republic did a new remapping, and they didn't find any problem on their side of the border. So those two, we are good here. Onco, it's a bit different because our last focus is on the Amazon region. It's in the middle of the jungle with a population which has no nationality. They are original population, and they cross the border freely. And they cross the border for many, many months and stay in the Venezuelan side and then come to the Brazilian side and do that. So our key work here is to try to coordinate the actions between the Brazilian side and the Venezuelan side for us to try to be at the same time in the area. A further political agreement is being seek, but as you know, political agreements take time, and this population cannot wait. So we are trying to coordinate with both programs to tackle, to give treatment at the same time in both sides of the border.
Yeah, and it's such a unique situation.
Yes.
Yeah, we're talking about. We have another question from Cyril, that's come in for Anna. What is the epidemiological situation of FGS in Liberia, and what control strategies are being used?
Yes, so FGS is endemic in Liberia. It's in multiple counties, and it has some areas of very, very high endemicity. They are doing MDAs at the moment. The funding for schistosomiasis MDA in Liberia has been a really significant problem since the end of the funding from as part of the Ascend program. So they've had to scale down some of the schistosomiasis prevention work that they've been doing. There was some funding that was found last year, and then again this year we've been kind of lobbying and advocating and trying to put together enough funding for the control. So most of the control of actual schistosomiasis is being still done through MDA. And then for FGS, what's been interesting is that there was a study that was done under the Countdown research with LSTM several years ago, where they tested a methodology for training and treatment for FGS. But I'll be very frank, because of the neglect of it as an issue, FGS is not in the HMIS. FGS is not routinely trained. Like, health workers are not trained in FGS routinely. It's not in the training curriculum. It's not a reportable disease. It's really just been completely neglected from the health system. So it was something that was highlighted in the NTD master plan, which is why we have started to really work and talk with Unlimit Health and with Alison about how we can take the model that's been used for the health systems work we've been doing and adapt that model to take the learnings that have happened with the FAST training package and other work that's been done and really strengthen that health system's response to FGS, because at the moment there is almost no diagnosis or treatment of FGS happening in the entire country in Liberia.
So an area of work to do.
A really important area of work to do, and seriously impactful.
So we're nearly at the end of our session, so I'm going to give you both one question, and I'll start with Ronaldo, and it's around gender, because obviously that's an important area of interest for Canada, is the inclusion of women and girls in programming, and it was part of their commitment, part of Canada's commitment to the Kigali Declaration is ensuring that women and girls are included as part of our NTD program. So Ronaldo, maybe from the perspective of the Trachoma project, if you could just give a couple of words about how PAHO is looking to include women and girls in the PAHO's Trachoma initiative.
Thank you, Alison. Yeah, I mean, definitely it's a way for us, it's a time for us to change perspectives. It's a time for us to stop, analyze the data just based on sex, because that doesn't give much an idea of what's going on now. So what the Trachoma project is bringing is for us to analyze the gender role. You know, it's to analyze in specific in one area what's going on, what's the role of the mother, what's the role of the young children, what's the role of the male in the community, and then try to focus on that. Because we know that many times the mother will not take their child, older child to take care, because they have a younger one. She needs to take care of this younger one. So it's a way we need to try to put in place a ways to take this mother to the care center, where they could easily have some activities for their children or something like that. So the Trachoma project came to give us a different perspective on how we evaluate gender and its roles.
Thanks, Ronaldo. Yeah, that's an exciting, I know, element of the Trachoma investment. So Anna, just briefly, if you could speak about the importance of women and girls in some of the health system strengthening work that Affect Hope has been doing with Liberia. And it could be aspirational too.
Yeah, okay. I think it may be more aspirational. Actually, we started a partnership this year for the first time with the GSIU, which is the Gender Support and Inclusion Unit at the Ministry of Health. So it's a unit as part of the integration that we've been doing. We've been doing a lot of implementation research along with the LSTM and the Redress Implementation Research Consortium to understand more about the inclusion of an impact on equity and women and girls. And the gendered impact on men as well in Liberia of NTDs, and ways to engage meaningfully with issues of gender and equity. And a big part of that in terms of the system was to begin building a relationship with the Gender Support and Inclusion Unit that just been established by UN Women. So we've begun working with them. They conducted a very initial gender kind of analysis recently, but what we learn and what we really realized from that is that we need to be able to sensitize people, like particularly people from those kind of units in multiple ministries of health, about the issue of NTDs, because they didn't have an understanding of NTDs. And it was not easy to articulate and be clear about what that a gendered intervention would look like and how that would work. So we're working together on that at the moment. We were having a webinar between them and the team at LSTM and us to try and increase their understanding and awareness of NTDs and why it matters to the GSIU. But they've been very, very pleased to work with the team. And it's great to see the NTD program collaborating a lot with GSIU as well, because that's a new relationship that's been developed through the program. So that's been really exciting.
Oh, that's exciting. Thanks. And what a great unit within the government of Liberia. That's fantastic. So we've reached the end of our time. I just want to thank, Sheila had to drop off. So that's why she's not part of this panel discussion at the end. But thank you once again to Ronaldo and Anna and Sheila for sharing your remarks today. Thank you to Senators Kutcher and Ravalia for opening with some meaningful remarks, and also to Mellissa Hisko from Global Affairs Canada. And of course, a big thank you to Tina and our team who's behind moving people in and out and queuing videos and doing all sorts of things in the background. So we will be posting this online. Stay tuned if you're in Canada for information about World NTD Day and what you can do to get involved. It's at the end of January. I know PAHO is going to have a webinar also, and there'll be lots going on globally, so do get involved. And if you're not yet a member of the Canadian Network for NTDs, we'd love to have you join the over 300 individuals who are part of our network, or 13 organizations. So please do reach out to Tina, and we'd be delighted to welcome you as part of our network. So thanks to everybody, wishing you a very happy holiday season and end of the year. Take care, everyone.
Thank you.
Bye.